Think about the prevailing assumptions surrounding female self-pleasure. Society largely operates on the belief that it is uncommon, physically harmful, or simply an indicator of a lonely life. But when we examine the scientific research, a massive disconnect emerges between what people publicly assume and what women do in private. The behavioral data entirely contradicts the stigma. Look at this diagram comparing self-reported sexual behaviors. It reveals that up to 94% of women engage in self-pleasure. The frequency is highly consistent as well, with the average falling between once a week and once every 2 weeks. Because nearly an entire population shares this behavior, we can classify it as a standard biological norm. The cultural shame surrounding it lacks any scientific backing. The root cause of these misconceptions comes down to a widespread misunderstanding of female anatomical hardware, and specifically how pleasure is physically generated. This chart breaks down how women reach climax. 97% rely on clitoral stimulation, while only 45% use vaginal penetration. Because penetration isn't the primary driver, women use diverse alternative methods, including hands, targeted pressure, and psychological elements, like erotic content, mirrors, and imagination. Because society falsely centers female sexuality almost entirely around penetration, we completely misjudge how women's bodies actually function and how they maintain optimal health. Moving past the external mechanics of touch, the internal response during climax involves a complex involuntary chemical reaction within the brain. Orgasm triggers a massive neurological cascade. It causes a sudden release of endorphins, dopamine, and critical relaxation hormones, flooding through neural pathways all at once. This chemical flood translates directly into tangible mental health benefits. The hormone rush creates rapid stress reduction and measurably improves sleep quality, leaving women feeling noticeably calmer. There are specific physical pain relief mechanisms at work here as well. Women regularly report that these hormonal rushes alleviate severe menstrual cramps, diminish chronic headaches, and relieve pelvic tension. This biological cascade serves a crucial functional purpose. It is a built-in physiological tool for managing a woman's overall physical and mental maintenance. The human nervous system is highly adaptable, and it inevitably adjusts to whatever specific repetitive stimuli it receives. This graph illustrates a documented phenomenon known as the vibrator gap. It shows that when high-intensity vibration is heavily relied upon, neurological sensitivity to softer touch, like fingers or oral, shows a decline, making it harder to reach orgasm through those methods alone. This adaptation is a temporary sensory baseline shift. The body adjusts to specific stimulation without causing permanent physical or nerve damage. The scientifically supported solution is rarely to stop using these tools altogether. Instead, researchers encourage women to directly incorporate high-intensity toys into partnered play if they desire. Understanding this physical adaptation shifts the conversation. Communicating about specific stimuli actively improves a couple's intimacy, proving that toys do not ruin partnered experiences. Zooming out to the macro level, we have to confront a widespread societal myth: the idea that frequent self-pleasure isolates women or serves as a replacement for romantic partners. Sociological research actually groups female sexual behavior into 3 distinct observable typologies. First is type 3, characterized by high masturbation and low partnered sex. This group often uses self-pleasure to compensate for a lack of viable relationship opportunities or satisfying sexual encounters. We can contrast this with type 2, low masturbation but high partnered sex. These women still enjoy partnered intimacy, but they frequently take longer to reach climax and report slightly less overall pleasure. This comparative visualization of the 3 typologies highlights the counterintuitive type 1. These are women with high masturbation and high partnered sex. The data shows they peak in both overall satisfaction and ease of orgasm, valuing sex highly across the board. The behavioral data confirms that self-pleasure does not replace partners. For the most highly satisfied women, it acts as an addition that actively enhances their drive for shared connection. A woman's active self-exploration connects directly to broader psychological outcomes. Women who engage in it regularly report higher overall body confidence and maintain a much healthier attitude toward their own sexuality. Knowing exactly how your own body functions physically is the mandatory prerequisite for communicating those needs to a partner. The data is clear. Female self-pleasure serves as the absolute, scientifically validated foundation of a woman's overall sexual health and relational success.